Welcome to our webinar today. We're so glad to have you. My name is Judy Levin, and I'm the Pollution Prevention Director at the Center for Environmental Health. I will be moderating the webinar today, and I'll be speaking only briefly and then turning it over to our main speaker, Dr. Ted Schettler. We are very honored to have Dr. Schettler with us today. Ted is the Science Director of the Science and Environmental Health Network. He is also Science Advisor to Healthcare Without Harm, an organization seeking to reduce adverse public health and environmental impacts of healthcare institutions. He has a medical degree from Case Western Reserve University and a master's degree in public health from Harvard University. He has served on advisory committees of the US EPA and the National Academy of Sciences. He is also the author of a report that I refer to quite frequently, entitled Antimicrobials in Hospital Furnishings. Do they help reduce healthcare-associated infections? We know that this topic is of great interest, and we've had more than 300 people register for this webinar. So just a few housekeeping details. You have all been placed on mute given our large audience. We definitely want to hear your questions, so please enter them into the question and answer button at the bottom of your screen. You can enter them at any time throughout the webinar, but we will respond to those questions at the end. We ask that you only use the Q&A function for your questions, as we would like to leave the chat button for anyone who's having any technical difficulties. My wonderful colleague, Sarah Packer, is standing by to help if needed. We're going to do a quick poll right now to find out who we are reaching. So please take a moment and select the response that best characterizes your role. Thank you so much. We will leave the poll open for just a minute or two, and then we'll share the results. So let's close the poll. I know maybe not everybody got a chance, but hopefully you did. And see who's on the line. So Sarah's sharing the poll results, and you can see our largest group today is actually the furniture industry, which is fantastic. And then we also have sustainability staff, suppliers, architects and designers, and purchasers. So wonderful, you are exactly the right people to all be having here. Facilities and maintenance folks and managers, perfect. So please go to the next slide. And if you can close the poll, that would be great. I still see it on my screen.
I think you can close it, Judy.
I can? Okay, thank you. Thank you so much. So the Center for Environmental Health is a nonprofit organization, and our mission is to protect the public from exposure to toxic chemicals. And one of the ways that we do that is by partnering with large organizations and sharing in with their buying power to consolidate the market pressure to move the market all in the same direction. So we are very excited to have purchasers on the line and sustainability staff, because you really can make a difference. Excuse me, I'm gonna just get my notes. Okay, the next slide, please. Great. In addition to furniture, the Center for Environmental Health is also focusing on moving the market towards healthier products in the area of carpeting and flooring, single-use foodware. These products also contain chemicals of concern, and safer alternatives are available. If you'd like more information about these products, we have the correct CEH contact person at the end of the webinar, and we would look forward to your questions. Great. So now I will turn this over to Dr. Ted Schettler. And again, welcome, Dr. Schettler. We're so happy to have you here, and thank you so much.
Thank you very much, Judy. And good afternoon to everyone. Thanks for joining the webinar, and thanks to Judy and Center for Environmental Health for inviting me. So our topic today is antimicrobials in the time of coronavirus. And what I hope to cover in the next few minutes, I'll start with some definitions just to make sure we're all on the same page, because I've seen some varying definitions floating around on the internet that I think are misleading. Then I'll talk a little bit about the virus itself, SARS-CoV-2, and the illness that it's causing, COVID-19. strategies for prevention, and introduce the concept of the hierarchy of controls and talk about how that applies in these circumstances. And then evaluating a potential role for antimicrobials in products and materials, and seeing where we are right now and then looking ahead to where we might go. From the standpoint of definitions, this is how I'm going to be using the terms throughout my talk. A microorganism also could be called a microbe. And this covers the whole gamut from bacteria to viruses, fungi, and some parasites. So it's not specific across those particular categories. An antimicrobial agent is one that kills some microorganisms or stops their growth. And I say some because antimicrobials can have very narrow spectrum of activity, and some of them have a very broad spectrum. And so we can't draw conclusions about the antimicrobial activity of an agent without actually studying it. The term cleaning refers to the removal of visible soil from objects and surfaces, and it's usually accomplished with detergents or enzymatic products. And it's particularly important when we're talking about SARS-CoV-2 because, as you'll see in a moment, plain soap disrupts the lipid envelope of this virus, disabling it, which is an important contribution and is one of the reasons why soap and water cleaning of our hands, hand hygiene, is so effective in removing the virus from our skin. And then disinfection is a process that eliminates many or all pathogenic microorganisms except bacterial spores. And it can be accomplished with chemicals that I'll talk about, but also it can be accomplished with UV light and heat and other physical interventions. This is a depiction of the virus, and there are just a couple of things that I want to point out about it. It's an RNA virus, and so here's a strand of RNA in the interior of the virus, and then it's surrounded by an envelope that's made out of a lipid bilayer. That lipid means it's made out of fat, and this is important because this is the bilayer that, as I've mentioned, can be disrupted by plain soap, and it's also disrupted by some of the disinfectants that we'll mention. And then the envelope is also studded with a variety of proteins, including the spike protein, which is noted here. And this is the protein that this virus uses to attach to receptors on the cells of the host, enabling the virus then to get inside of a host cell and begin to reproduce. It is spread, as you're aware, I'm sure from all the information that has been flooding the news over the last several months, primarily by airborne transmission through both large and small droplets. And small droplets are sometimes form what's called aerosols. And these can result in direct exposures. The large droplets tend to drop to the surface or drop to the floor through gravity fairly close to the person who emits them, whereas the smaller droplets can remain suspended for a much longer period of time and actually travel much farther. And we're now learning how much more important this aerosol transmission is than we once thought. And I'm giving you here a couple of very recent references. One is an editorial that was published in Science just a few days ago, in which an aerosol scientist laid out the argument for why this is an important method of transmission. And then the other link here is to a recent National Academy of Sciences webinar that I attended just last week, in which an aerosol scientist actually gave some very useful information on this method of transmission. Of course, the virus can settle onto surfaces in our homes, workplaces, and other places in the community, contaminating the surfaces. And then if someone contacts that surface with their hands, for example, it enables the virus to be transferred indirectly from the surface onto a person's face, to their mouth, their nose, their eyes, and so on, which is certainly a potential pathway of exposure. One that the CDC continues to say is not the main pathway of exposure, but nonetheless is one that may be more important in some settings than others, and one that's of particular interest in this webinar today. As you know, this virus is highly contagious, and it can be spread from asymptomatic people, which has made it particularly difficult to deal with. This is a graphic depiction of those various pathways of exposure that I just described, with heavier droplets dropping to the floor fairly quickly, aerosols traveling farther and remaining suspended for a longer period of time than the larger droplets. Some of them can land on surfaces, as I mentioned. But then I also want to introduce a couple of other variables that turn out to be quite important. The concept, the importance of outdoor air ventilation, and how increasing outdoor air ventilation can really reduce this aerosol concentration in the indoor environment, as well as looking carefully at heating, ventilation, and air conditioning systems, and how they may be utilized to also reduce the aerosols, including running the indoor air through a high efficiency particle air filter before putting it back into the space. And this is a method that a number of universities and commercial buildings are beginning to adopt as a way of addressing the indoor air quality and indoor air contamination. So the concept of the hierarchy of controls comes from the world of occupational health, and has been a concept that has been widely used for years for the prevention of occupational diseases, and it becomes obvious that it's applicable far beyond the world of occupational health. It's the idea that there are multiple levels of intervention that can be used to control occupational diseases, including infectious diseases, such as we're talking about today. And they range from some that are the most effective to those that are the least effective. But unfortunately, it's often the case that the most effective ones are the ones that are the most difficult to actually deploy and put into action. So what we'll see in the response to COVID-19 and SARS-CoV-2 is a blend and a mixture of these various levels of intervention with the hope of using multiple ways of addressing what really is a systems level problem. So we've seen this, for example, in hospitals where, of course, we've seen a lot of emphasis on the use of personal protective equipment, masks and respirators, gloves and face shields and so on. Hand hygiene, critically important. Then routine cleaning and disinfection has been also very important for reducing hospital transmission of this virus. Testing and isolation, when you identify people who have the infection, isolating them from others is a way of getting higher in the hierarchy of controls, where you're trying to eliminate the virus from certain environments. And then a number of hospitals have begun doing more with the ventilation, where they're not only increasing the outdoor air supply, but also using negative pressure in rooms where patients are infected, so that you keep the virus confined in limited areas and not allow it to spread throughout the hospital into common areas. In communities, we're seeing various levels of this hierarchy of controls as well, with spatial separation, emphasis on personal protective equipment like masks and hand hygiene, and then cleaning and disinfection and testing and isolation, all combining to try to reduce community-wide spread. And similarly in our homes, where people are emphasizing hand hygiene, routine cleaning and disinfection, and when someone in the home is infected, beginning to even embark on more of this isolation and quarantine and so on. Now, if we look into other workplaces beyond hospitals, what we're beginning to see as workplaces reopen, or in those that have remained open throughout the pandemic, are frequent illness checks, which is an attempt to keep people from the workplace who might have symptoms. So this is higher on the hierarchy of controls, where you're trying to eliminate the hazard from ever getting into the workplace to begin with. And then, as I've mentioned, a number of businesses are deploying healthy building strategies, such as bringing in more outdoor air, including even opening windows, increasing the outdoor air ventilation rate, and using high efficiency particulate air filters. And passing, and again, this is the URL for that presentation on the recent National Academies webcast, where the scientist, his name is Richard Corsi from Portland State University, gave a wonderful presentation on just how effective these strategies are in terms of reducing the aerosol concentrations in a confined indoor environment. Maintaining physical distancing is good and essential, and then cleaning and disinfection, of course, is a very important component of the prevention strategies. And what we want to talk about more today is whether there are other antimicrobial technologies that might be useful. This is a graphic presentation that comes from Joe Allen at the Healthy Buildings program at Harvard University, where he's simply put across the top these various components of the hierarchy of controls, and then below them show the examples of how these could be used to reduce the risk of COVID-19 in the workplace through the various levels of interventions. And the question we're asking ourselves in this talk also is whether there's a role for antimicrobial surfaces in addition to all of these other interventions, including the other engineering controls like optimizing ventilation, filtration, and purification. So getting to this question then of the surfaces, there have now been 2 studies that I'm aware of that have looked carefully and using very valid methods for studying how long the virus remains infectious on various surface materials. And I stress remains infectious because that's really the key parameter that we're interested in. If you have a virus on a surface and you leave it there long enough, you can, far down the road, you can identify the RNA or the DNA of the virus through various laboratory tests. But the important question is whether the virus remained infectious. And I'll talk a little bit about how one goes about doing that testing a little bit later. But these are the numbers that they came up with. I've put asterisks beside the numbers that come from the study that was published in Lancet. And then the ones that do not have an asterisk were those that were published in the New England Journal. And their methods were very similar, but slightly different, so that it explains why, for example, we have a range of between 3 and less than 7 days on plastic. For example, the study in Lancet did testing at 4 days, and then if they found any infectious virus on the material at 4 days, they didn't do any more testing until 7 days. So in the Lancet study, the virus would have remained infectious somewhere between 4 and 7 days, and we don't know what that absolute number is. But they're in the same ballpark, and you can see that on plastic and stainless steel, the virus remains infectious for several days, whereas on copper, for example, it remains infectious for only about 4 hours. Similarly, on paper, only several hours. Cardboard, about a day. So you can begin to see how strategies could be developed depending on the surface material that we're considering. So to address this virus and its infectivity on surfaces, I think we clearly need to start with cleaning and disinfection. These are proven methods of killing this virus, of rendering it non-infectious. And I emphasize cleaning first with soap and water for 2 reasons. One is that soap has the impact on the virus that I mentioned earlier in terms of disrupting its lipid membrane. But secondly, cleaning gets organic material and oily material and other things off of the surface that then enables a disinfectant that gets applied afterward to be much more effective. So the list of disinfectants that are effective against this particular virus are available on the EPA's website at the link that I've given here. And they have an N list of products which have been certified as being effective against this particular virus. And I want to point out a couple of things about those products. First of all, their own toxicity in terms of human health impacts varies from one to another. So keep that in mind as you're making choices among disinfectants. And also their dwell time varies. And what that is the amount of time that the disinfectant needs to remain on the surface as a wet liquid in order to disable this virus. And their dwell time varies. Some of them will disable this virus within 1 minute. For example, both ethyl alcohol and isopropyl alcohol have very short dwell times, whereas others take several minutes to work. So it's important when you're thinking about disinfection strategies to make certain that you know what the dwell time of the disinfectant that you're using really is. Some of these have impacts as respiratory irritants or sensitizers that can cause or trigger asthma. So that's important to keep in mind. A number of the products on the N list contain quaternary ammonium compounds, and these are chemicals that can, trigger or cause asthma. Similarly, household bleach or sodium hypochlorite can be a respiratory irritant and cause or trigger asthma in some people. So if you're going to be using those kinds of compounds, for example, they should be used in well-ventilated areas, preferably with respiratory protection, and when using bleach, for example, with gloves to keep from skin contact because it's a strong skin irritant. But there are less toxic examples of disinfectants that are quite effective against this virus. And I've listed some of the less toxic examples here, hydrogen peroxide being one, as well as the alcohols that I've mentioned, and then there's citric acid and lactic acid. But it's important also to pay attention to the compatibility of the surface that you're disinfecting when you choose a disinfectant, because some, for example, will discolor a surface or bleach a surface or stain a surface. So that needs to be kept in mind when you're making a choice of disinfectants. Now, as Judy mentioned, several years ago, I did a literature review looking at this question of antimicrobials in hospital furnishings with the question of whether they help reduce healthcare-associated infections. And along with a couple of colleagues, we released this through Healthcare Without Harm, and it's available at the URL that I've provided on this slide. And although it's now 4 years old, it still has a lot of material in it that's quite relevant to our current circumstances. It, first of all, recognizes healthcare-associated infections as a systems problem that is multifactorial and requiring multifactorial interventions. We talk at length in this report about the role of contaminated surfaces, and it's a very similar conversation to today. The importance of cleaning and disinfection is undeniable. We summarize the antimicrobial coatings and surface technologies and their efficacy. There have been some advances in the last few years, but they are incremental advances in the various technologies that have been around for a while. And of course, we're seeing movement away from some and toward others. And then the other thing that's in here that may be of interest to some of you is a summary of the laboratory test methods to evaluate bacterial loads on surfaces. And now some of these have been modified to evaluate impacts on viral loads and viral infectivity. And I will mention just a couple of those in just a couple of minutes, but the summary of the methods are in Appendix C of this report. So the antimicrobial technologies generally fall into these categories. There are chemicals, some of which have been now phased out because they had limited effectiveness and represented risks to users and also environmental risks. So we don't see as much triclosan, for example, being used. And triclosan had some antibacterial properties, wasn't particularly effective, had no antiviral properties that I know of. But then we're seeing a continued emphasis on metals, including copper, silver, and zinc. And there are a number of different formulations of those, including nanomaterials, and I'll mention that a little bit more in more detail in a moment. There are antimicrobial polymers that have been developed, and this is a burgeoning area of interest where material scientists are figuring out ways to include antimicrobial portions of disinfectant-like compounds, for example, quaternary ammonium compounds. How would you include a quat in the polymer chain and thereby be able to create a polymer that you could make a surface coating out of or a hard surface out of that actually had built-in antimicrobial properties? So this is a continuing emerging area of material scientists. But in the healthcare settings, the efficacy of deploying these technologies, the efficacy in terms of reducing healthcare acquired infections has not yet been shown. There's no doubt that these technologies can, in some instances, reduce the microbial burden on the surface of the product. But whether that translates into a reduced incidence of infections has not yet been shown in the hospital setting, although there's some signals that it perhaps could under some circumstances. But as we all know, COVID-19 has increased pressure on manufacturers to expand the more general use of these technologies. And so the question I think we all need to ask and sometimes and try to answer is, will this be driven by data having to do with efficacy, safety, durability, or will it be driven by hope and assumptions? And I think we're sort of at an important crossroads for answering that now in the third or fourth month of this pandemic. This is just a screenshot of a paper very recently published just in April that briefly explores the use of nanotechnology and material science to help with the fight against SARS-CoV-2. It's publicly available at that link, and I thought the authors did a good job of sort of describing where the nanotechnology is right now and where it might go as more materials are developed. So what is being promoted now? Well, certainly we're seeing a lot of discussion of both copper and silver and sometimes zinc nanoparticles. So there are various ways that those are made and deployed. Sometimes they're put into what are called zeolites, which are nanoporous aluminosilicates, where the positively charged metal ion can form a reservoir in these little pockets in these silicates and serve as then a reservoir that is slowly released to the surface of the coating or the material over time. There are multiple mechanisms of action that these metal nanoparticles are probably using to have their antimicrobial action. They're not fully understood, but some of them that are well described are inhibiting nucleic acid replication. Some of them will denature enzymes, making it impossible for the virus to reproduce. Some damage the envelope that I described. And then there's diffuse oxidative stress, which is damaging to the virus. Some of these have broad spectrum antibacterial activity as well, and some of them have impacts on a whole variety of viruses, although we have very little information about the impacts of these on coronaviruses, specifically SARS-CoV-2, even more specifically. So the question is, are these technologies, any of them that I've described, effective? And I think the first question that we need to ask is, what do we mean by effective? And that depends on what our goals are. So I'm just posing some goals here to consider. Not that one is necessarily better than the other, but would we be satisfied with simply reducing the infected microbial burden on a surface, irrespective of whether that had any impact on disease transmission? Or is our goal to reduce viral transmission and the incidence of infections? Or is our goal to increase a sense of safety in the workplace, to make employees, for example, feel a little bit more comfortable returning to work, knowing that something was done to put an antimicrobial surface on a desk or a chair or a light switch or something, even if it has no particular impact on disease transmission. So those are the questions. There aren't necessarily right answers to them, but if we're going to talk about effectiveness and efficacy, it's the kind of question we need to begin with. And then if we dive down a little bit more deeply into the concept of efficacy, we would want to ask, how is the product evaluated? How does that compare to the conditions of use? In other words, if you take an antimicrobial coating on a product and test it in a laboratory, and don't think about how that product is actually going to be used in the workplace, can you draw conclusions from the laboratory test to how that product is going to perform in the workplace? So that's an important question that to always keep in mind. And then depending on the test that was used, how generalizable are the results to a whole range of microbes? We know, for example, that there are a number of valid tests that are used to explore antibacterial effects. And some of them are very effective at doing that. But if we don't look at the antiviral effects, we're not going to know whether they have an impact on the virus. And then specifically, do they have an impact on coronaviruses? And if that hasn't been studied, we can't necessarily draw conclusions because some are effective against certain viruses, but not others. And then how long does the effect last under conditions of use? So as I mentioned, the URL at the bottom here gives a summary of the test methods that have been used for evaluating primarily antibacterial properties. But now we're starting to see more and more data on the impacts on infectivity of some of these test methods on viruses. And I've shown here a few, like the influenza virus, HIV, hepatitis C, herpes simplex virus, and adenoviruses, where we actually have some fairly good data on how some of these nanometals and other technologies have an impact on their infectivity, but we have very few data on the impacts on coronaviruses specifically. Now, this is just a slide to give you a sense of how one of the more commonly used test methods has been modified to go from evaluating antibacterial action to looking at antiviral action. So you'll find more of the detail in that Appendix C of the document I just mentioned. But basically what the antiviral test needs to do for a solid material, say if a material that was going to be, for a light switch or a surface of a table or a chair or something, the virus would first need to be cultured in a cell culture. And then a known amount of the virus is transferred onto the surface of the product that has the test antimicrobial properties that you want to evaluate, and an untreated control sample. So you put a known amount of the live virus onto those surfaces. Then it's held in place for a prescribed period of time under prescribed environmental conditions. And then when that time is over, whatever you're interested in, you want to know what it did in 3 hours, what it did in 4 hours, whatever it was, you then remove the virus from the surface and put it back into a cell culture that's appropriate for that particular test virus, and see whether or not that virus retained its infectivity. And there are ways that is quantified, so you can then say with some precision about the % log reduction of viral infectivity that happened over the period of time that the virus was on the surface that you're evaluating. So that's sort of just a brief summary of how that needs to be done for viruses. That's a modification of the way that it's done for bacteria. And then the other link here at the bottom is to a similar method that is used for evaluating the antimicrobial activity of treated textiles. And it's a similar kind of modification where you put the virus on the textile. After a period of time, you remove it from the textile, put it back into a cell culture, and see if it's still infective. So where are we? Well, as of now, as near as I can tell, there's no evidence that adding antimicrobial properties to the surface of products adds value to the current array of current recommendations for reducing transmission of SARS-CoV-2 or COVID-19. That could obviously change, but I emphasize here the array because at the beginning I was talking about that whole hierarchy of controls, the multiple levels of intervention that can be used that are proven to reduce SARS-CoV-2 transmission and disease. So I think where we're ending up for purchasers in healthcare, and I think that this is going to apply much more broadly because I think these ideas are transferable from one workplace to another. That if you're considering purchasing furnishings with these antimicrobial properties with the hope that they may either reduce the viral load as one element of a system's response, or reduce viral transmission, or reduce infections and illness, and or help reduce concern and add a sense of security, that at least one should look for evidence of efficacy and consider downsides before making a purchasing decision. What kind of evidence to look for? Well, studies of efficacy in destroying the coronavirus infectivity, as I just described, were validated methods for evaluating efficacy used. What were the experimental conditions and how did they compare to the real world conditions of use? How long do these virucidal properties last under conditions of use? And what are the implications for proven cleaning and disinfection protocols? So for example, if a product is treated with an antimicrobial technology of some kind that works in a laboratory test and has the kind of impact that you're looking for, but it wears off in a week, or if it doesn't stand up to cleaning and disinfection, which must be carried out as part of the system's approach, then you actually may have created a false sense of security by investing in that antimicrobial property when it turns out it's not doing very much after a few days or a couple of weeks. So having this kind of information when making purchasing decisions will be important. And then are there potential adverse health or environmental impacts of this antimicrobial on this product? And I bring this up because you bring these kinds of products into a workplace or into a home, people are potentially going to be exposed to that antimicrobial technology or product. If it leaches from the surface of the product and there's a human exposure, then there's a potential for an adverse health outcome. So that needs to be evaluated and understood, and it would be incumbent on the manufacturer to begin to explore the potential health and environmental impacts of this so that purchasers could make more informed purchasing decisions. For manufacturers, I think our recommendation will be that without more data, that you should avoid making added antimicrobials a standard option for any product, with the exception, of course, of those that are used solely for product protection. And that's an important point, that some products, because of their very nature, need to have a preservative in them to maintain the integrity of the product. But what we're talking about here is adding antimicrobials for a health benefit. That antimicrobials should be a must-select option to make the decision clear, as well as to track the demand for these products containing antimicrobials. And if antiviral properties are added to high-touch surfaces on request because of COVID-19, that manufacturers should use technologies that are proven effective in reducing the infectivity of the coronaviruses under conditions of use, and have a person who's buying the product understand what the limits might be. Take the lead or collaborate in an execution of a research agenda to fill in these data gaps that I've been describing related to efficacy and risks associated with adding these antimicrobials to furnishings. There's certainly a lot of data gaps, and we should be able down the road with well-designed research agendas to figure out where benefits are and where the risks are and where there's simply no added benefit at all. And again, require full toxicity testing, studies of leaching and evaluations of potential exposure. Some of these nanomaterials, for example, can leach from the surface of materials and directly contact people in the workplace or who are using the product. There can be direct exposures, and some of these nanomaterials can be absorbed through the skin. And often they have unpredictable and sometimes surprising toxic properties because of not only the material that they're made of, but the very small size. So for example, nano silver, whereas may not be particularly toxic in a non-nano form with direct human toxic exposure on the skin, once it gets internalized in the nano form, it can end up in very strange places in various tissues of the body and have toxic effects that one wouldn't have anticipated. So that's all I have. Thank you very much. There's my contact information. And Judy, I'd be happy to take any questions that have come along.
Yeah, thank you. Well, can I unmute video myself? Thank you. Thank you so much, Ted. That is just an incredible presentation. We do have a host of comments and questions. Before that, I just want to take one more quick moment to pass on some information. And please bear with me because I know you want to get your questions answered, and we'll do our best to answer all of them. I just want to mention, as purchasers or sustainability people, that there is now a new credit within the BIFMA standard. It's called Targeted Chemical Elimination. It's 7.4.4. And what it does is it restricts what we call the hazardous handful, what Healthcare Without Harm calls the Healthy Interiors Challenge. So it restricts the use in certain amounts of flame retardants, the fluorinated stain treatments, antimicrobials, PVC, and formaldehyde. And this standard, this particular criteria is optional. So just because you have a BIFMA level certified product, you need to specify this particular chemical to avoid these chemicals of concern. And while there's BIFMA level 1, 2, and 3, with 3 being the highest, this criterion could apply to any level. So again, you just need to specify products that meet that particular criteria. Next slide. So CH is here to help. If you've been, we can do webinars for organizations. We have resources on the products that we work with. So furniture, flooring, and carpeting, and disposable foodware. We have technical specifications you can get. We have lists of healthier products. We can offer product testing for certain chemicals of concern. And then we do customized consulting and technical assistance with organizations to help them implement healthier purchasing practices. So in the next slide. I do want to let you know about a webinar that's coming up that's being sponsored by the Interstate Chemicals Clearinghouse. We knew we could not fit everything in today, and so there's another group that's offering a specific one on safer cleaning and disinfecting, both in the workplace and at home. And you can see the information there, and we encourage you to get further information at that time. Next slide. I think that's just our contact information. So as I mentioned, we offer carpeting and flooring. I see we're all reversed, sorry. Single-use foodware, office furniture. I cover furniture. My colleague Sarah Packer covers flooring, and my other colleague Sue Chang covers single-use foodware. So thank you so much. I want to get back to the questions because there are a lot. Ted, could you spend a few minutes talking about using these products in K through 12 schools?
Well, I think that the important thing in schools is to emphasize cleaning and disinfection. Particularly important to use some of the safer disinfectants in schools, because you don't want to start triggering asthma attacks in kids or causing asthma. And there are plenty of safer ones there. So cleaning and disinfection is going to be important. And then, whether adding antimicrobial surfaces in schools, I mean, it's the same conversation about whether it's a school or an office building. No proven added benefit, but cleaning and disinfection is absolutely proven to be effective and should really be instituted.
Great, and that really flows into the next question. If soap and detergent destroys the viral body, why are disinfectants also needed?
Well, it's a great question. I haven't seen any data where people took a surface and just treated it with soap and then compared that to a disinfectant. This particular virus happens to be quite sensitive to soap because of the lipid bilayer that I mentioned. So it certainly is an important step forward, but using the disinfectant, I think, is also wise on heavily used surfaces, high-touch surfaces in particular places. But in the home, soap and water, in a home without an infected person in it, emphasis on soap and water.
Yep. Besides the sun, is artificial UV enough? Is that how powerful would it have to be?
So there is, the technology is called UV germicidal irradiation. And it's the particular wavelengths of UV light that are useful for killing viruses and bacteria. And there's a narrow wavelength that is useful and it has less effect on people's skin. And these products are being developed now, and I'm beginning to see them being installed in buildings. So, for example, you can imagine if you have the air being pulled out of a indoor space into the plenum above bringing the aerosol, any infected aerosol up, and then you're going to run it through a air filter before you put it back into the room. If you had UV light shining across the top of that room, it might be an added benefit. But yeah, UV is getting increasingly used as one component of a systems approach to this virus.
All right, we still have a number more. Can you please explain the difference between the terms antimicrobial and antibacterial?
Yeah, so antimicrobial refers to an agent that kills or slows the growth of a microbe. And a microbe can be bacteria, can be a virus, can be a fungus, can be a parasite, some parasites. Antibacterial refers to agents that only have impacts on bacteria, not on viruses, not on fungi. So antibacterial is a narrower term than antimicrobial.
Great. What is the comparison of the timeline that COVID-19 remains on the surfaces versus other common viruses? In other words, does COVID-19 remain on surfaces longer?
Yeah, it's a great question. And you'll actually see some discussion of that in the links to those two articles that I mentioned. And there is a difference. COVID-19 lasts longer on plastic and stainless steel, for example, than, as I recall, than, for example, influenza virus. So there is a difference from one virus to another. And that's why that information about how long COVID-19 remains infective was so important to us, because we didn't know how long we needed to think about it.
Great. Is there a list of cleaning disinfectants that affect asthma?
Yeah, the place that I would, let's see, how would I do this? I would refer you to both the disinfectant list that I described, which gives a long list of the disinfectants and their active agents. And then I would also refer you to the Association for Occupational and Environmental Clinics, AOEC. And if you search AOEC asthmagens online, you'll get to a long list, and you can search it however you want to, but a list of chemicals that are known to be asthmagens. That is, a chemical that either can cause or exacerbate asthma. And so if you did a cross-reference of those two lists, you would figure out which ones. But if you had a particular disinfectant that you were wondering about, take the name of that disinfectant, the active ingredient, go to the AOEC website and see whether it's an asthmagen or not.
Great. Are antimicrobial polymers, would they need to be registered with EPA and Canada regulations? I'm not sure I understand.
Yeah, so the way, did you say Canada?
Yeah, EPA and Canada regulations.
Well, I can't speak to Canada, but I'll speak to the US EPA.
Yeah.
If the product manufacturer makes what is considered to be a health-related complaint, claim, then it does need to be EPA registered and be evaluated by EPA through their pesticide program. And when I say a health-related claim, if the product manufacturer says something like, this product fights germs, or it provides antibacterial protection, or it controls viruses, any of those statements are considered by the EPA to be a health-related claim. So what we often see is a product manufacturer making a product that has antimicrobial properties, but they don't want to make a health-related claim because they don't want to have to go through all the hoops of full EPA pesticide registration. So they might say something like, it helps to reduce stains, for example. Or you will often see, for example, if you buy some socks that are impregnated with silver, you'll see that it says it controls odor. It won't say anything about reducing germs. So you have to read the labels carefully, but if the antimicrobial polymer makes a health-related claim, yes, it does need to go through EPA registration.
Perfect. That actually flows really well into this question. What testing labs in the US would be recommended for appropriate testing for antimicrobials on products? Many manufacturers are self-proclaiming with a false sense of efficacy.
Yeah, there are a number of testing labs that will do these validated test methods that I just described. And I don't have the list, but there are commercial labs, a number of commercial labs that will do that. I would also note that for the person who asked about asthma, disinfectants and asthma, Vina Singla just put up on the chat box a link to a website where you can actually find the answer to that question about disinfectants and asthma, which ones are related to asthma.
There are some great resources being listed, and we will share those with you. How does the addition of antimicrobial particles affect the recyclability of the materials it's added to?
It depends entirely on the antimicrobial, what it is, because it will depend on the antimicrobial and what the product it's added to is made out of. So there's not a single answer to that.
Okay. Do you think it's a good idea to add an antimicrobial to face masks? If so, which antimicrobial should be considered and which one should be avoided?
Well, it'll depend a little bit on the mask. If a person has an N95 mask, these are high efficiency face masks that actually have a lot of antibacterial and antiviral properties built into them, and you don't need any other thing added. I have seen face masks with copper oxide added that are being marketed now, and I have no idea how effective that copper oxide is, but it would need to be tested. I don't want to dismiss it, but just to say that these products need to go through testing to see whether they add value or not, beyond just the mask itself.
Yeah, we're seeing a lot of antimicrobials being added to everything with no science behind it, which is concerning. Somebody asked, I've heard some concern regarding some of the antimicrobial products available, that they actually contain some of the materials that are considered unsafe or fall under forbidden material lists for companies who have strict sustainability policies. So can you confirm that it's true? And if yes, which specific materials are the issue?
Well, it is true, and some companies have much stricter policies than others. Some companies, for example, IKEA has very strict policies about what biocides they allow to be added to their products, and have a fairly stringent list, whereas others aren't as stringent. So it varies from one company to another what the sustainability uh, uh, policies are.
Great. And I know you mentioned the quaternary ammonia compounds are especially of concern because of their asthma inducing effects.
Well, that's among the disinfectants. Yeah, yeah,
Yes, right.
yeah.
How relevant are test results with other lipid enveloped viruses like HIV or influenza to coronavirus? Is it close enough to at least give us some idea of the coating's efficacy in reducing viral load or infections?
Yeah, it's a great question. I think that what I've been able to glean from my reading of this is that they give you a clue about whether they're going to have an impact, uh, but there are some surprises. So there are some enveloped viruses that do not behave the same way as coronaviruses. But I don't think I mentioned it, but one of the things that testers are doing is to say, look, testing against SARS-CoV-2 can be dangerous because it's an important pathogen and it's causing a lot of serious disease. So there are other coronaviruses, like, for example, the coronavirus that causes a common cold, that are much safer to work with in the laboratory. And one could probably draw fairly valid conclusions from evaluating the antiviral activity of a particular product on another coronavirus, like the one that causes the common cold, and draw inferences about SARS-CoV-2 without having to handle a dangerous virus. So there probably is a fair amount of overlap among the coronaviruses that would give us some good hints.
Great. Can you elaborate more on the synergy between surfaces and effective cleaning methods? Maybe instead of choosing antimicrobial surfaces, we could choose surfaces that enable quick and effective cleaning, materials that don't degrade easily from soaps and disinfectants. What are your thoughts on this?
Well, there are products that are being marketed as both cleaning and disinfectants. And if they do that, the EPA requires that they be tested in a way that shows whether or not they're effective on a dirty surface. So, yeah, I think there are ways of trying to address both cleaning and disinfection, but they would have to be tested to see whether they were effective when used under conditions of use. There are all kinds of interesting technologies that are being tried. For example, there's a bacteria that are not pathogenic to people, sort of as a probiotic approach, where we're actually, rather than to disinfect a surface, we're putting healthy bacteria on a surface, making it less hospitable to pathogenic viruses and bacteria. It's sort of an approach that's being developed now and being tried in some hospitals in Europe. And I'm seeing more and more interest in the United States as well.
Yeah, in regard to the last question, I think maybe the question is, if you have a surface that's easily cleaned, do you think that's more effective than trying to use an antimicrobial?
Generally, yes, but if you're in a home, let's say, with a sick person in it, with somebody with COVID-19, or if you're in another setting where you have a high suspicion that there's COVID-19 in the environment, disinfecting high-touch surfaces in addition to cleaning is certainly being recommended by, for example, the Centers for Disease Control. But I think the emphasis on cleaning is really important, and not feeling that one has to disinfect every surface in a house routinely.
Yes, it is 1:02. There are still more questions. Ted, would you be willing to stay on? And if people have time, they can stay
I'm
on?
willing, and I don't know what your schedule is, but I'm willing to stay on.
We have a large, we have a large number. I think we're going to stop. Please don't put any more in, or send them to me separately so we can get them answered offline. If you had to choose, all things considered equal, do you prefer antimicrobial finishes on surfaces or a method of UV cleaning as a more effective antimicrobial prevention? That's a hard question.
Well, you know, I'm concerned about the rush to antimicrobial surfaces because we don't know as much about their efficacy as we would like to know. And for many of them, or in the past at least, there have been real downsides. So an antibacterial surface, for example, there are some that we know can foster antibiotic or antimicrobial resistance in organisms, which then can be a real problem down the road. So I think the idea is to avoid the use of them except where they've been demonstrated to be helpful. And as part of a systems approach to this problem. But I think the big mistake is to begin throwing antimicrobials into everything with the hope that it might help reduce illness. That I think is just a mistake. And I think where we need to go back to is the basics of cleaning and disinfection and the hygiene measures. These have been proven in hospitals where they're dealing with COVID-19 patients. That you do this combination of isolation of people who are sick, strict measures to hygiene, and the engineering controls and so on that I described, and screening and testing, that you can literally stop this from being transmitted in the hospital. And so I think in a workplace or another environment, we can learn a lot of lessons from that we could apply.
Thank you for saying that, Ted. I think that's a really important point. What level of filtration is needed to remove particulates from the air for HVAC?
Yeah, I would recommend that looking at the link to the webinar that I gave, because it was a really nice presentation by Richard Corsi, who described the efficiency of the filter that is needed, and it's really the HEPA filter is effective against this virus. So that's not you know, something that's beyond the reach of many people, even for your home, a HEPA filter. So, but for the details and the micron size and so on, he gave a really nice presentation, and his slides are available, and his talk is available at that website.
Great. Some textiles like wool, silicone claim naturally antimicrobial properties. Can you speak to the effectiveness and the health impact of these materials?
I know that I know of those claims. I don't know how, and I don't know how they've been tested to validate those claims, and I certainly don't know how they've been tested to validate any viral claims. So beyond that, I don't want to sort of pose to guess.
I think there's another question about, curious question, why does paper have such a short dwell time or length of time the virus stays active versus paper money in terms of viral infectivity?
I think it's because paper money is more complex. That the material in the paper money is more complex than plain paper, one of the generalizations that people have noted is that the virus tends to remain infective on solid surfaces more than on soft surfaces. So I think it has to do both with the texture of the material as well as what it's made out of.
Great. There's some other questions about labs, Ted. I don't know, people are asking for recommendations if people could do specific tests like the 2 JIS test methods with virus.
Yeah, there are a number of commercial labs that can do those, and I don't have recommendations of one over another. Mm-hmm. But as I've been searching around on the internet recently, I see a number of commercial labs that are advertising, but I don't have a recommendation.
Okay. Can you discuss EPA registered pesticides versus treated article or non-EPA registered products?
Yeah, so as I mentioned before, if a product is marketed as having a health benefit because of the antimicrobial technology that's built into it, that product needs to go through pesticide registration at the EPA and being evaluated for both health, safety, and effectiveness. And it's a rigorous registration process. However, built into the EPA regulations is what's called the treated article exemption. If the antimicrobial is added to the product to preserve the material that the product is made out of, for example, if it's a product that's made out of polyvinyl chloride, which is subject to microbial degradation without an antimicrobial added to it, or your shower curtain, for example, might have an antimicrobial added to it to preserve the shower curtain, but not because they claim that it offers you any health benefit. Then the manufacturer of that product can claim a treated article exemption. The antimicrobial that's added needs to be one that is registered with the EPA, but the product itself does not need to go through a full evaluation. So that's where you see shower curtains or socks or whatever it is that might have an antimicrobial in it that's put in there to preserve the product. It needs to be one that's registered with the EPA, but it doesn't need to go through a full pesticide regulatory evaluation that looks both at the safety but also the efficacy of it.
Great. This person's asking for clarity. He said, I understand well there's no evidence now that antimicrobials can be effective against the virus, but are you saying there are chances that they might have some effectiveness, but we just don't know at this moment?
Well, wait, now antimicrobials, the whole list of disinfectants, they are antimicrobials. They're not built into the product, but they are applied to a product, and they do have action against this virus. So they're proven, and we should be using them where we need to be using them. I think what the question is doing is well, what about the antimicrobial properties that are built in?
Yeah, I think maybe
into
that's
the product. Yeah, and as I mentioned, we really don't have much, if any, data on the effect of these on SARS-CoV-2 and how long that activity lasts. And how does it stand up to cleaning and disinfection? So these are some of the research gaps that I think we need to get filled, and we need to be encouraging these kinds of studies before we're making purchasing decisions.
Great. Here's
because some of them very well may be effective if our definition of effectiveness is reducing the microbial burden on the surface of the product. If that's what we're looking for, we can get that answer. On the other hand, if our definition of effectiveness is it reduces transmission of the virus and reduces the risk of COVID-19, that's a different question.
Right, absolutely. And here's a question about, you mentioned data gaps on efficacy. Do you think this research belongs to the antimicrobial manufacturers?
I think in part it does, sure, particularly if a company is marketing something. On the other hand, I did notice on the EPA website or a link to the EPA website that they are in the process of doing some evaluation of technologies that goes beyond disinfectants. So it sounds to me like, although I don't know the details of this, it sounds to me as if the government also may be beginning to look at or fund some research into strategies for addressing this problem, but I don't know the details of that. But I do think that there are some private-public opportunities here for getting some answers to these questions.
Great. Any ASTM or EN standards on this topic?
Well, the AST, there are a lot of overlaps. I didn't find any ASTM for viruses specifically, but that doesn't mean they don't exist. There are for bacteria, but I couldn't find ASTM stuff on viruses.
Okay. What do we know about the chemicals, nanomaterials being incorporated into products and the risk of developing microbial resistance to them?
Yeah, the nanomaterial that may be of some concern are the silver nanomaterials. And I only mention silver because there is some evidence of bacteria, not viruses, but bacteria developing resistance to silver. And that's been known for a while. Whether or not it's really a practical concern is not yet clear. But the mechanism by which silver can do that with bacteria is to develop a mechanism that actually, when the silver enters the bacteria, there's an exporting mechanism that some bacteria have developed that can expel the silver from the inside of the bacteria. And that can be coated on what's called a plasmid in the bacterium that then could be transferred to other bacteria. So at least there's a theoretical concern that silver resistance could be passed on from one strain of bacteria to another. I'd have no idea how practical that concern is turning out to be. And I haven't seen anything like that with viruses. So yes, I think there is a theoretical concern about developing resistance, but I don't know yet how, from the metals, the nanometals. For sure, with some of the antimicrobial chemicals, particularly those that have been used in the past, it's a real issue.
Right, and we don't want to create superbugs that are resistant to all our treatments. Do you consider, I'm going to guess the word is Thymox-based disinfectants to be safer and appropriate for use in schools? Our custodial team is looking at using such a product in an electrostatic sprayer. It has a 4-minute dwell time.
Yeah, I don't know Thymox specifically, but I'm guessing that it contains thymol, which is one of the EPA disinfectants on the N list. And I think it's generally considered to be one of the safer ones. I did see a note from someone just a few days ago saying that there's some evidence that thymol might be a respiratory tract sensitizer, but I don't know that personally. I haven't seen those data, so I'm just passing that along. And so for the person who's asking the question, I would just check to see whether Thymox contains thymol, and if it does, what is the evidence that it might be a respiratory tract sensitizer? But it's certainly one of the safer ones on the list.
Thanks. Who will register and test the efficacy of these antimicrobial products? My understanding that EPA does not register products like these UV disinfection machines.
Well, I don't know how. I don't know the answer to about how the UV disinfection machine would get registered or certified. I don't know the answer to that.
Okay. Is UV germicidal the same as UVC?
Yes, it is. UVC is one of the narrower portions of that UV bandwidth, and it is a UV germicidal. So I think there's some overlap in the terms, but UVC is a narrow part of the bandwidth, and it is a UV germicidal irradiation.
Okay, here's another one. Have appropriate surrogates for COVID-19 been identified for testing purposes?
Well, the surrogates that I have seen used are the coronavirus that causes the common cold, which I mentioned. I think it's coronavirus 229E. And then there are 3 or 4 veterinary coronaviruses. One that causes a severe gastroenteritis in pigs, but which is not pathogenic to people. One that causes hepatitis in mice, and one that causes some disease in dogs. And those are relatively safe to handle. And so those are 4 different coronavirus surrogates that I have seen studied where people are using them as surrogates to try to draw inferences about other coronaviruses. Because remember, this coronavirus we're dealing with now is not the first really serious one, but rather SARS, when it showed, the first SARS, back in, I think, 2004 or something like that, was a serious, it got wiped out because people got on top of it quickly, but it was a very pathogenic. And similarly, the Middle East respiratory syndrome, MERS, was another serious coronavirus. So studying those, you really need to be in a biosafety lab and be careful with those. So that's why the coronavirus surrogates are useful. And those 4 that I mentioned are ones that I've seen used.
Here's a question about, is asthmagen categorization relevant for an embedded compound, for example, quats in a polymer?
If there were any release, if there were an exposure, then you would be concerned about it. But if it's locked up in a polymer, then you don't have an exposure. Then you're much less concerned about the health effects.
There would still be worker health effects though, right, Ted? The people who are producing
That's
them.
true. Thanks for mentioning that. I mean, anybody who's manufacturing these products would need to be concerned about them in the manufacturing process.
Mm-hmm. Thanks. What about the use of hypochlorous nebulizers? This person characterizes them as non-toxic.
Yeah, that's an area that's of considerable discussion and debate. All I'll say is that hypochlorous nebulizers, hypochlorite is really a strong oxidant and can be very damaging to tissues. So I'd be very cautious.
Okay. I think we're just going to take, we'll go 3 minutes more at 1:20, and then we're going to have to stop. Are there any testing protocols specifically for virus efficacy that are non-laboratory based, like real world testing?
Well, you could do this. You could do the same kinds of tests in the real world. I mean, but you'd still have to do something in the laboratory to do it. Because if you're really interested in infectivity, you're going to have to study infectivity. And that means you're going to have to take the virus and put it back into a cell culture. Because unlike bacteria, viruses need to get into a living cell in order to reproduce. And so you need to put the virus back into a cell culture and see if it retained its infectivity. And I think the only way to do that is in a laboratory.
Mm-hmm. Okay. There's a few questions related to the CEH services. Let's see if there's one more for you, Ted. I think we kind of got most of them. If we've missed your question, please let me know and we'll try and get an answer for you.
One thing I wanted to mention, Judy, I did see as we were going along some more things put into the chat box, some good resources. Will you be able to make those available to the participants?
Absolutely. There is such a plethora of great ideas here. There are some questions about why antimicrobials were added to the hazardous handful list as part of the 7.4.4, and the answer is because they've not been shown to provide efficacy in furniture, and that they're not needed. And so because we don't know all we need to know about them and they're unnecessary, we've made that part of the hazardous handful. I hope that answers your question. And then someone else asked if there's a way to identify those products right now through Ecomedes or other ways to find out which products meet the hazardous handful criteria. Through level was the other question. My understanding is that's coming, but I have not seen it. CEH does have a list on our website of healthier products that meet the hazardous handful, as does Healthcare Without Harm. And I will try to find out the other answers though. Somebody asked about foodware. The issue with foodware right now, disposable, is that a lot of it contains the fluorinated compounds in the sort of the bio-based materials like the gas and sugarcane and wheat. And there's concern that there's some transfer of the fluorinated compounds to the food. And also if it's composted, which is where it's supposed to go, then it can actually contaminate the compost. And some of the newer PFAS chemicals, the fluorinated chemicals, can be uptaken by plants. And then you actually end up, I guess, re-eating them. And there's a bunch of concerns about the fluorinated compounds, as people know they're dubbed the forever chemicals because they don't break down for very, very long periods. And some that do break down into concerning byproducts. And Ted, you can probably speak more to that. So we're encouraging people to use reusables because really there is no other good alternative. Recycling is not happening at the rate it needs to. And so many facilities can't handle the compostable foodware. So reusables is a better solution. Ted, do you have anything to add on that?
No, I don't.
Okay. Oh my gosh. Okay, we're after 1:20. I just want to thank everybody for being here. We still have so many people attending, and we will try to get you all these wonderful resources. And thank you so much for being on the line. Thank you so much, Ted, for answering this great number of questions. It was absolutely wonderful. Lots of positive comments.
My pleasure. Thank you for the invitation.
Thank you. Thank you, everyone. And stay well and just hang in there. We're going to get through this. Okay. Okay. Bye-bye.